ashver.com.
Hello and welcome to ashver.com. You are watching an interesting and informative video on most effective cure for plantar fasciitis from stretching exercises.
Please read the disclaimer carefully.
How to treat plantar fasciitis. The goal when treating plantar fasciitis is to reduce the inflammation of the plantar fascia, and to allow time for the tears in this important tissue in your foot to heal. Luckily, the majority of cases of this common but painful foot condition respond well to do-it-yourself treatments, although the time it takes to get pain relief will vary considerably with each person. Exercises that will gently stretch and strengthen your plantar fascia are important for healing. In fact, doing these exercises consistently is probably the most effective remedy for plantar fasciitis. The excellent video below does a great job of clearly demonstrating several plantar fasciitis treatment exercises. These foot stretching exercises are easy for anyone to do and don't take long. They should be done first thing in the morning. How quickly your foot responds to the stretching will depend on the severity of your condition. Along with foot exercises, it really helps to stay off your feet as much as possible. Of course, the practical needs of everyday life do not allow many people to sit for hours with their feet up. But when you can find the time, do give your feet a rest. And while you have your feet up, it's a good idea to apply ice to the bottom of your painful foot. Frequent sessions of applying ice can really reduce the inflammation and pain. Night splints for plantar fasciitis. Many people treat their foot pain with a night splint, which gently stretches the plantar fascia while you sleep. This can make all the difference in the world when it's time to get up in the morning. If doing the full routine of foot exercises shown in the video seems like too much to do when you first wake up, then put brace to the stretching for you while you sleep. This not mean foot stretching exercises need not fit in somewhere during the day. But a brace for plantar fasciitis you wear at night provides a lot of convenience, and for many people, really speeds up the process of healing. Shoe inserts for plantar fasciitis. Orthotic shoe inserts or shoe insoles that provide excellent arch support should be in all your shoes if you have any pain at all on the bottom of your feet. Even the mildest pain or discomfort indicates the need for good shoe inserts to forestall the worsening of your condition. Try to remember to put on shoes with inserts first thing before getting out of bed in the morning. Even after doing the foot stretching exercises in the video, you should still put on shoes rather than walk barefoot. You need to give your feet every advantage possible when trying to reduce any inflammation or injury to the plantar fascia. In fact, a helpful practice is to have your shoes by the side of your bed, or even on your night table. The important thing is to have them within easy reach so you can get them without automatically putting your feet down. The reason this is important is that the pain of plantar fasciitis is essentially the result of poor arch support over time that has worn down the plantar fascia tendon. Therefore, you should never go barefoot or wear shoes with no arch support. This is why shoes like flip-flops are bad for your feet. Taping for plantar fasciitis. As part of a routine to address your plantar fasciitis, taping your foot with athletic tape can be beneficial. Runners and other athletes often use this method to provide some temporary restriction to the foot, without providing too much restriction. The goals of foot taping include reducing pain, reducing the likelihood of foot injury, or coping with injury that has already happened. One drawback to taping is skin irritation. It's important to use the best athletic tape to lessen the chances of this happening. Another problem that can occur is allergic reaction. Of course, either of these conditions is reason to discontinue taping. Diabetics should not use this method at all. Cortisone shots for plantar fasciitis. As stated above, Most cases of plantar fasciitis respond to conservative treatment that a person can manage alone. However, if after an extended period of time you are still experiencing terrible heel pain in spite of trying other methods for pain relief, your foot doctor may recommend a cortisone shot. These shots either go directly into the plantar fascia or on the big toe side of the heel or arch. How long your pain relief will last cannot be predicted. It could only last a few days or it could extend for a few months. But even a short time of being pain-free gives a person a morale boost and breathing room to consider other options. Symptoms of plantar fasciitis. Although other conditions can cause chronic heel pain or arch pain, a diagnosis of plantar fasciitis may be made if you frequently have pain on the bottom of your foot, especially at your heel. At first, your pain may be more like a dull ache that you mainly feel first thing in the morning, but it often progresses to a sharp stinging sensation that lasts throughout the day. Sometimes this pain is localized at the heel, or it may be in the arch area. Tingling and numbness are other common symptoms. Plantar fasciitis is not to be confused with just having sore and aching feel after being on them all day. That kind of soreness can be dealt with just by kicking off your shoes and putting your feet up for a while, or by soaking them in something like Epsom salts. Unfortunately, plantar fasciitis is more serious and debilitating. What has happened is that the plantar fascia, the long, fibrous tissue that runs from your heel bone to the base of your toes, has become inflamed. Although the area around the heel is often where the pain is most commonly felt, the foot's arch can also be the center of pain. This is because the arch depends on the plantar fascia for much of its support. The inflammation of this connective tissue therefore causes pain in the most vulnerable areas of the foot, the heel and the arch. The most effective cure for plantar fasciitis will result from stretching exercises, either ones you do yourself or the very effective stretching created by night splints. It's also important to always wear shoes designed with good arch support or to wear arch support shoe inserts. You should never go barefoot. Also, try to spend as little time on your feet as possible until your pain becomes less frequent. Most cases of plantar fasciitis can be managed adequately without the intervention of medical procedures, like cortisone shots. Surgery for this foot condition is rarely performed. Our feet have to support us so much of the time, yet we generally don't give them the attention they need until they make us miserable from plantar fasciitis or some other foot disorder. Pain relief should be followed by a greater awareness of all our physical needs, not just those of our feet, but for all parts of. Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.